You've just been informed that your child's therapist has diagnosed your child with an anxiety disorder. But which one is it? And why does it matter? There are many types of anxiety and anxiety-related disorders containing various symptoms that your child may be experiencing. By identifying the disorder, the therapist is better able to work with you and your child to provide effective treatment to meet your child's needs. In this video, I cover each anxiety and anxiety-related disorder in a brief outline to give you a starting point in understanding your child's diagnosis. Hi and hello. Welcome to Nurturing Youth Counseling. I'm Colette, a licensed professional counselor partnering with you in your child's social and emotional development. I answer questions about children's mental health and provide skills that I've learned while in private practice and with my own children. Come journey along with me on this roller coaster ride of life that we call parenting. Please be aware that what I'm providing in this video is a brief description. The therapist usually goes more in depth when looking for a diagnosis. This brief outline should in no way replace mental health therapy or seeking out medical services if you need them. Well, ready to dive into the world of anxiety as therapists know it? Let's go! Reactive attachment. This is when you've experienced neglect or deprivation during your first few years of life. Usually you're withdrawn and rarely turn to others for comfort, support, or protection. You show little positive emotion and may exhibit unexplained fear or sadness. Disinhibited social engagement. This is also when you experience neglect or deprivation before the age of 2. Unlike reactive attachment disorder, you don't really need to bond with anyone, and you also don't understand the concept of boundaries, so you're willing to go with anyone, stranger or not. Separation anxiety. This is when you're excessively afraid to be separated from your caregiver. You may persistently worry that you're going to lose the person closest to you. You may be reluctant to go out, away from the home without that person. Or you may even experience nightmares about separation. Selective mutism. This is when you don't speak in some social situations, but you do in others. For example, your child may speak to you or a friend in the home or outside, but will refuse to speak at school. Social anxiety. This is when you have a persistent fear and discomfort about being watched, negatively judged, or criticized by others. Examples are extreme fears of public speaking, meeting new people, or eating in public. Specific phobia. This is when you have an excessive fear of a specific object, situation, or activity that's generally not harmful. Examples of this are fear of flying, needles, or spiders. Panic disorder. This is when you have recurrent unexpected panic and fear that peaks within minutes, commonly known as panic attacks. You may experience extreme physical symptoms such as trembling, shaking, sweating, shortness of breath, chest pain, or dizziness. Because the symptoms are so severe, you may believe you're having a heart attack or other life-threatening illness. Agoraphobia. This is when you have intense feelings of anxiety about being unable to get help or escape from a situation or place if a panic attack arises. You fear leaving your home, being in a crowded area, or using public transportation. Obsessive-Compulsive Disorder. This is when you have recurring unwanted thoughts, ideas, or sensations, known as obsessions, that just won't go away. In order to get rid of these unwanted obsessions, you feel driven to do something repetitively, known as compulsions. Not performing these compulsions, such as hand washing, checking on things, or mental acts like counting, will cause you a lot of distress. Hoarding disorder. This is when you have persistent difficulty getting rid of or parting with possessions due to a perceived need to save the items. The items are not organized in any way and result in congested and cluttered living space. Animal hoarding is when you acquire a large number of animals which are housed in an inappropriate space, potentially creating unsafe conditions. Generalized anxiety disorder. This is when you experience persistent and excessive worry that interferes with daily activities. You're usually expecting something bad to happen. You may experience some physical symptoms such as restlessness, feeling on edge, or easily fatigued, difficulty concentrating, muscle tension, or problems sleeping. Body dysmorphic disorder. This is when you're preoccupied with what you perceive as flaws in your physical appearance. They're not noticeable or appear slight to others, but are seen as ugly and completely abnormal to you. Muscle dysmorphia. This is when you're preoccupied with the idea that your body is too small or too big, or not muscular enough, when in fact it's average looking. Trichotillomania. This is when you repeatedly pull at your own hair, most commonly from the scalp, eyebrows, or eyelid region. Excoriation. This is when you repeatedly pick at your own skin, causing lesions to form. Adjustment disorder. This is when you experience an unexpected, intense form of stress from an event, like a breakup or dealing with an ongoing illness. You may feel tense, sad, or hopeless, withdrawal from other people, and act defiantly or show impulsive behavior. Posttraumatic stress disorder. This is when you have intense, disturbing thoughts and feelings related to your traumatic experience. You may relive the traumatic event through flashbacks or nightmares, feel sadness, anger, or fear, and you may feel detached from other people. Acute stress disorder. This is similar to PTSD, but has a different time span associated with it. You may relive the trauma, have flashbacks or nightmares, and feel numb or detached from yourself. As I said before, these are very, very brief descriptions of anxiety and anxiety-related disorders. There's a lot more that goes into the diagnosis of an individual, but hopefully this gets you a starting point to know what your child's diagnosis is. Please like, share, subscribe, or drop a comment below if you found this helpful. As always, thank you for watching, and until next time, don't forget to breathe and enjoy this roller coaster ride of life that we call parenting.